love this new music, by the way. I know we're talking about serious things today. I just had to say that. We are talking about coronavirus restrictions in Oregon. Yesterday, if you watched us on the news, it was at 5 counties that will start new restrictions this coming Wednesday. Yesterday, the governor announced 4 more counties are joining that list for a total of 9 now. And we have Dr. Jennifer Vines, the health director for the metro area, joining us early this morning. Thank you so much for getting up with us and answering folks' questions and, you know, who is kind of contracting the virus more now, what the hospitalization rates are. So this is the great thing about this show. It's totally unscripted. We are watching your guys' comments on YouTube and Facebook. So if you have a question about COVID, Dr. Vines can do the best job of answering that. We've already gotten about 10 questions here on Facebook on a previous post. So first of all, Dr. Vines, let's start with some basics. What is the state of COVID in Oregon right now? And we've been talking about that upward trend over the past month. What's happening to kind of keep us going up?
State of COVID-19 in the 3-county Portland metro area, cases are going up sharply. And we saw that heading into the end of last week and over the weekend. Part of that is from expanded testing, but most of it is from increased viral spread in our communities. So it's worrisome. We're seeing spread among younger people, but we're also seeing busy hospitals at the moment, busy with COVID-19 patients, but also busy with the day-to-day care that people need. So whether we'll see a wave of hospitalizations from COVID-19 in the 2 weeks following this increase in cases, which is usually what we look for, remains to be seen. But there's real concern among those of us working in public health and among the hospital systems that we are headed into a very serious time, and that we're essentially climbing the wave, the curve essentially that we wanted to flatten. And did successfully flatten last spring.
You know, you have made yourself so available to all the news outlets to try and spread the word. You've got to be disappointed at this particular time because we as a state were doing so good early on. You mentioned back in the spring when we had some of the lowest infection rates in the country. And now what? Are people just kind of fed up? They're like, I'm done. I'm kind of, you know, I'm pent up. I'm cooped up. I can't do it anymore. How do you explain it?
I think I'm concerned. I'm not particularly surprised by these events. I think heading into the fall and winter, we've been keeping a sharp eye on cases. We know that COVID fatigue is real. We know that people want to be with their loved ones heading into these darker months. And it's really hard to sustain behaviors that don't necessarily come naturally. So I'm concerned that it's happening already in November. I had hoped that we could delay this moment, but we are here. And so it's really important that the public understand the times that we're headed into, the potential strain on our healthcare systems, whether that's people with severe illness from COVID-19 or people just needing routine care for all of the other things that can happen, car accidents, strokes, heart attacks, and the fact that the rest of the country is on essentially the same trajectory means that there's going to be limited resources. So we need to come together here locally and do the right thing by canceling our social plans, keeping to our households, and trying to get this curve down to protect our elders and our loved ones with underlying conditions.
I'm seeing some people like Melissa Perez. She's asking, what about schools? Because it was just 2 weeks ago, Governor Kate Brown came out and kind of relaxed some of the COVID metrics that schools, at least for a lot of the younger grades, would have in order to be able to open in-person classes. And it's about 23% of Oregon school-age kids would be able to, at whatever point their district feels they're ready, to open back up in some form to in-person. How do you feel about that now, just in the past 2 weeks, seeing where we're going with schools potentially opening up across the state?
I think we really supported another look at the school metrics, and I'm speaking for regionally for the 3-county area. The state was among the first to come out with metrics for return to school. They were extremely cautious in their thinking. And just as you point out, a couple weeks ago came out with metrics that were less stringent. I fundamentally agree with that approach. Unfortunately, we're headed into a more serious timeline right now of just the next 2 weeks. So as much as I want to see kids back in school, I think right now we are basically asking people to stop mixing completely for at least the next 2 weeks to try to get our case numbers down.
So we also have a question that says, are all COVID patients in Oregon hospitals people from Oregon? Are there any other states that are at capacity?
I am not aware of any large-scale transfers of patients from other states, but I'm also not involved in the day-to-day resourcing of hospital beds and taking requests like that. But I don't know of any large-scale transfers of patients from out of state.
There's people still, debating whether wearing a mask works. Dr. Vines, what say you on that?
It is one of the most important things people can do as they go about their lives. And we know that even asking people to keep to their households and essentially do a voluntary quarantine these next 2 weeks, that still leaves essential workers out there and people needing to do essential things like take care of loved ones and pick up groceries. Wearing a face covering or a mask is absolutely one of the most important things you can do when you are out and about. It contains your droplets. So we all spray out droplets from our mouths and noses when we talk or speak or laugh or sing. So it contains your droplets and keeps them to you. It also filters out a fair amount of other people's droplets. So it protects the wearer and it protects the people around the wearer. So I unequivocally endorse using face coverings and masking as much as possible when you can't guarantee that you'll be more than 6 feet from someone.
On our stream, we have Joshua Madrid, who's one of our regular viewers who chimes in the mornings. I know this is the governor's call, but maybe you could give us a little bit of insight into what perhaps could happen. He wants to know, do you see bars/restaurants being asked to close again if our case numbers don't go down during this 2-week pause?
We have struggled with the question of restaurants and bars, and this viewer is correct in pointing out that this is a state decision and it's essentially state authority that restricts things like bars and restaurants. We wrestle with this because we don't know that if it's better for people to be in a structured environment where people are distanced, where face coverings are the expectation in a restaurant as opposed to just gathering in their homes or in their basements. I think we also have an obligation to the business community collectively to avoid the kind of whiplash of open and close and give them enough lead time so that they're not stuck with inventory or perishable food that they're going to take losses on. So I fundamentally agree with the governor's approach of taking voluntary measures first, and then she has announced a wait and see approach. I think we in the metro area really are emphasizing just the next 2 weeks because that is essentially a quarantine. So anybody who has potentially been exposed to the virus recently, a home quarantine essentially for everybody could really suppress transmission and get us back on track.
I have a question, and I know Pat Doris has asked you this question for me, and Morgan Romero asked this question for me to you. And now that I get to see you, face to face, so to speak, the restaurant thing so the new restrictions that start tomorrow would limit capacity to restaurants, including employees, to 50 people indoors. Now we have, all of these wonderful restaurants and great places, that I want to stay open, are putting up tents outside, but now they're lowering the flaps on the tents, and now we're adding heaters in the tents, and they have, these plastic flap walls, and it's basically an indoor structure outdoors. Do you know, and I know you're not, like a state official or, you're obviously on the medical side of things. Does tomorrow's restrictions for the next 2 weeks, do they affect the tents that are outdoor, indoor? And how does that, if we're not as safe indoors, what is the difference between a walled tent outside? I don't know.
So I have been asked this question before. I can't speak to the regulatory component. There is a regulatory component here. I think from just a health standpoint and a risk standpoint, ventilation and airflow matters. So being outside, with a 3-walled tent is probably better airflow than being completely inside and potentially sharing airspace with other restaurant goers. I think a completely enclosed tent that's really just your household, people you would interact with otherwise, with a server, just having brief contact. Again, that's probably lower risk than sharing.
Okay, like the
airspace
mini
in
huts that we've
restaurant.
seen. Okay.
I don't mean to misquote you, but I was listening to Think Out Loud on OPB on my drive home from work yesterday. And I do think that you were talking about this with the host. And you said sometimes being in an environment like a restaurant where they're taking lots of precautions and everybody's masked up and they've got partitions or whatever they're doing in their space is probably safer than sitting in somebody's basement outside of your own household, kind of mingling with lots of different people.
Yeah, at the end of the day, addressing this pandemic is really about influencing health behaviors, which is one of the hardest things to do, especially when it doesn't come naturally. So there are real questions about whether providing a structured space for people to socialize that has precautions built in is a better option, especially just knowing that people want to socialize and want to be with loved ones. If that's better than closing everything and having people kind of go underground, so to speak, and socialize in small houses, smaller settings, where they may be less, there be maybe fewer prompts, say, to maintain a distance or to use a face covering.
So I have a personal mantra since this whole thing started, back in March. And every time I think I want to cut a corner, my personal mantra is COVID doesn't care. It's not like I can fool you, Dr. Vines, because you're not looking at me all the time. But if there's something out there that I'm exposed to, it's going to be there whether I wash my hands because I'm in a hurry or I take that extra time to slip on my mask before I walk around. So that's what I try to remember. This is a virus. The virus does what it's going to do regardless of what I do. And if I have the misfortune of coming in contact with it without taking precautions, I open myself up to greater risk. Do you remember when you were here back in March? Nina and I were talking about this in one of our commercial breaks, and you were sitting in our studio and we were all just, COVID noobs. And I remember kind of giggling. I'm like, there's a right way to wash your hands? I mean, can you think back over the last 8 months of everything that's changed? I can't even imagine what your job and your life has been like because you are front and center. People are always asking you things and you always have to really kind of survey the landscape and try and give people the best possible medical advice.
Thank you. I mean, that's my job. I'm a public servant. I'm here to share the best information I have as I understand it at the moment. And I think it is important to take a look back and remind Oregonians of how successful we were in the spring of avoiding a hospital and health system overload, of reminding people of our relative success over the summer. We had a few bumps. Everyone said, is this the surge? Turns out in hindsight, those were just probably little spikes. I think dialing back to the kind of collective energy and spirit and everyone in it together to flatten the curve for the sake of our healthcare workers, our Black and Brown communities, our elders, anyone you care about with an underlying condition. I think that's the kind of energy we need now heading into fall and winter. And I know it's an extra lift at this particular moment in time, given the short days, the holidays. But I think that's what we're really asking people to do.
Okay, a couple of questions from viewers here. I'm looking on Facebook. Trish Madral, thank you for your question. She's curious, Dr. Vines, do you and your family go out to eat in a restaurant or do you get food to go?
I think every household has to decide what their risk is based on who their household members are, what their personal level of anxiety is around COVID-19 and how that balances against things like the pleasures of eating in a restaurant versus getting takeout. So my household and I are making those decisions the same as everybody else. I think what I keep front and center is I remind people that the definition of a close contact is within 6 feet for at least 15 minutes. And that's really regardless of a mask. And so as I go about my day, I ask myself, if the person I'm with tests positive for COVID and I get the call that I've been exposed, am I going to have to quarantine if I meet these criteria? And so that's sort of my benchmark of how I'm really minimizing my own personal risk and that of my household.
Can we talk a little bit about mental health? Because we've been focused on physical health, but mental health is super important as well. Virginia Carlson talks about the isolation in the dark, rainy Pacific Northwest that is just catastrophic when then you have to physically distance. And I mean, I know my kids are grown, but my son does not live with us, and we have seen very, very little of him, only outside with a mask on. And as the holidays come, you know, he was asking me, am I going to be able to come over? And now Clackamas County, where we live, is going to be lumped in, or is lumped in, with these restrictions. And it kills me to say, I don't think so. We've got to come up with some creative ways that we can toe the line health-wise, you know, for the greater good. But I get it. I mean, it is, as a mom, the hardest thing that I've ever had to do. It's like, we're not going to be together on Thanksgiving. No, we're not. I don't know if we're going to Zoom it, or if I'm going to drop off a care package, you know, in the morning. But can you speak to that kind of mental health dynamic that we're all feeling right now?
Definitely. We take this just as seriously as we do the pandemic. I think people's need to be with others, especially in these darker, colder months, is very real. And there are also real health implications, so-called collateral damage, to how we address the pandemic in terms of behavioral health and many, many other things. So we are absolutely aware that we are really urging people to tap into their creativity, understanding that this probably is a once-in-a-lifetime global pandemic. 2020 has been an extraordinary year. We are not in this forever. There's good news about vaccines, but those are still at least months away. And so what we're asking right now is for people to be creative and to tap into that desire to be together and channel it into creative solutions, whether that's bundling up outside for a walk, which is great for your mental health, whether it's, as you're pointing out, planning a Zoom Thanksgiving instead of in person, planning gatherings that essentially lower your risk on that spectrum of trying to be outside, using face coverings, making sure no one who is sick is at the gathering, and really taking as many precautions as people are able to within the confines of what they need for their own immediate mental health.
I've seen several people ask about the death rate in Oregon, and they are putting more stock in that instead of the positivity in test rate. Do you know what is the percentage of people who die from COVID here?
I don't have that number at my fingertips. I can say overall, Oregon has done well, and I say that with humility, knowing that hundreds of people have lost their lives to this virus, and hundreds of families are grieving those losses. But Oregon, on the scale of the United States, has actually done quite well. And I think, again, looking back, the measures that people have taken so far, the original stay at home, the precautions that people have taken, those have all bought us time to learn about the virus, time for our healthcare experts to figure out treatments and what works, time to get our hospitals organized and ready to hopefully expand to accommodate the need. All those things also contribute to saving lives. So it's partly what we're asking the public and every one of us to do to lower the spread, but it's also acknowledging that we've learned a lot in the last 10 months that also helps us contribute, hopefully, to fewer people, or as few people as possible dying from this virus.
You know, one of the things that people are talking about on the stream, there's a group kind of going back and forth about COVID and protests. And I remember back in May, after George Floyd was killed, everybody came out nationwide, really around the world, during the pandemic to protest. Now that months have gone by, and in Portland we've seen, still some gatherings of, sizable gatherings. Do we know anything more about that particular link between the protests and COVID, what it is, if it is? Do you have any more actual data from what people are telling you with the infection rate?
Yeah, we tend to have some of our best understandings in hindsight with this virus. And so as we went through this summer, I got this question a lot. And we were very worried when we first saw the protests. We, of course, didn't intervene from a public health standpoint because of racism plays enormously into public health. And I think as the summer went by, we worked with protesters. We made sure they knew they could get tested at our county easy testing site. We asked people who were positive if they had been to a gathering and what type of gathering they had been to. So we looked for that spread, both in terms of encouraging people who had attended to get tested and in trying to look for it as we interviewed people with the virus to see if that had been a contributor. We did not find a significant contribution from those protests to our cases. And again, as we look back over the summer, we saw some waves that followed Memorial Day weekend, July 4th weekend, when people were largely gathering socially. And we never found a big contribution to those case numbers from the protests, despite really looking for it.
I know some people, Candy Bernard Davidson, thank you for your question. She says, what's the pause? Can you say again what it is? I jumped in after this started. So starting tomorrow, Wednesday, 9 Oregon counties, and I know we have a map of those. It's going to be the turquoise blue ones. It's Multnomah, Clackamas, Washington, Marion, Jackson, Umatilla, and Union counties. Boy,
Malheur.
And Malheur County. Thank you. That was pretty close. Those 9 counties will start what Governor Kate Brown calls a 2-week pause on social activities. So in those counties, they're asking all employers, please, if your workers can work from home, have them do that for at least the next 2 weeks. Limit your social gatherings to just your household or at least 6 people or less. Restaurants, gyms, pools, fun places like bowling alleys or museums, you have to limit your capacity, including employees, to 50 indoors. And again, work from home. So that all starts tomorrow in response to this spike in COVID cases, where we have gotten, very close to our record is at 988 set on Saturday for daily records. So that's what we're talking about. And Governor Kate Brown going to be talking about the hospitalization rate live today at 1 o'clock. We'll carry her press conference on our social pages and I believe likely on here on Channel 8.
Dr. Vines, can you set the record straight real quick? Amy is asking, why have our testing levels flattened or even decreased? Why is Oregon behind? I understand you to say at the beginning of this conversation that we're actually doing more testing.
So testing capacity has actually expanded in the last couple of months. I'm not sure if this particular viewer has more details about how Oregon compares to other states. It's certainly possible that we are behind other states in our testing capacity, because I know it has been something we have struggled with. But some of this increase, about 20% of the recent increase, is actually from expanded testing.
Okay. I was just scanning through to see if there was any other questions. What can you leave us with, Dr. Vines? What is Brenda has her mantra of, COVID doesn't care and it's out there, don't let up. What's kind of your personal mantra at your house? What should we kind of leave with as we go into the holidays?
Yeah, so I would say I would leave you with this idea that our individual choices add up in ways that we can't always see or predict or understand. So this ask of people to voluntarily stick to their households as soon as possible, but officially starting tomorrow, and really limit their social contacts as much as possible for the next 2 weeks, has really far-reaching implications for our elderly, for our healthcare workers, for people with chronic conditions, and for the communities of color that we're seeing disproportionately burdened with this virus. So as people head into these next 2 weeks, please take every precaution, limit your social contacts, use face coverings if you have to go out, and take at least one step to take your risk down a notch.
And to help people visualize this.
Forever.
Yeah. But I know you guys have given some really great, vivid examples of like somebody, having a wedding, and even they kind of kept it small. I mean, can you tell us a quick story that kind of has the multiply effect that you're talking about?
There are stories like that get headlines. One from another state where a wedding led to spread to a household, from the household to a friend, from a friend to a roommate, and from that roommate into a long-term care facility that sparked an outbreak. Yeah. So this is the world we live in. We are part of a large social web, And I think we all need to keep that front and center going into these next 2 weeks and frankly into the next few months.
Well, I know you are a very busy woman with, again, all the demands on your time. But Dr. Jennifer Vines, thank you for spending 25 minutes with us this morning and our viewers to pass along some very important information. Thank you so much.
My pleasure. Nice to be with you. Thanks for having me.
Yeah, thank you. And again, Governor Kate Brown going to be speaking at 1 o'clock today on COVID hospitalizations. We'll see you tomorrow.